Thank you everybody for joining our webinar today on the electronic claims submission. And what we're going to be doing today is we're gonna go through pretty much the full process on submitting claims, how to from that point submitting the claims all the way through to actual posting of the payments, whether they're coming in electronically, your ERAs or electronic remittances. And also if you receive your payments via paper EOB and check. So the first thing I want to tell you about electronic billing is that here in Iconotes that there's three main areas that you have to have set up before you can actually submit claims electronically through the program. Um, First thing you want to do is make sure that you have your settings and directories configured, and I'll just run through those really quickly in just a moment. The second part is you want to make sure that your demographics are input for all of the billing information to pull through regarding the client's name, date of birth, policy number, so on and so forth. And the third part that the billing comes from in Iconotes is from the actual note. Now our program is note-based, so if there's no note, there's no claim. Got to be a note in there. Even if you're inputting the notes just for billing information, like if you're doing hospital billing or anything like that, that you still have to have some kind of note in there. Okay, so those are the three areas that it pulls from. So what we're going to do is I'm just going to run through these fairly quickly just to show you the different areas that you want to have populated in there. Some easy ways to kind of copy and paste some of the data from one provider to the next, especially if you have a lot of providers. Okay, so we'll start here in settings and directories. And then when you come into settings and directories, you just want to click the show button down here at the very bottom, and it's going to highlight all the fields that you need for billing in yellow. Okay, I like to start over here on the group level settings. And you just want to make sure that you have the sites selected here in the left-hand column. You want to make sure that when you click on those here in the yellow fields that you have an NPI number, the place of service, and you also want to make sure that you have the 9-digit zip code. That's a big one I see a lot of people miss. So you just want to make sure that you have that populated here into your site facility info tab. And then you can click over to your letterhead tab to push it over using these gray buttons, and it'll populate it there. And then really important tab you have to have filled out is the electronic billing tab. Okay, so if you've ever used like a paper claim where they have, box 32, that correlates to that section, and then box 33 is here for the billing address, and then the pay to address is just where you want your money to go. This will show up on statements and such, which we'll cover that a little closer to the end. Okay, and if you have multiple, like if you have one place where you provide the service and a different address that you want the money to go, and then you have a PO box for your pay to address, you can create 3 different sites and just select those from the drop down menu to have that populate appropriately. Okay, now the service mod codes, this is where you just want to have a short list of your billing codes here on the left. If you're doing any kind of institutional billing, that means you're using like a UB04 form, which we're not covering that today. But if you were using it, you would want to put in your revenue codes. If you're outpatient and you're not billing institutionally, or if you're not sure, you're probably not using this part at all because you would know what a revenue code is. All right, and then you have your modifier code short list. You can create a short list of all the different modifiers you use. This just makes it really easy to select from a drop-down list. And then the next tab is your insurance payers. Okay, so here on the short list, you want to put in a list of all the different payers that you use, and you want to make sure that you have these yellow fields populated. Okay, now if you don't know what the phone number is, you could put in a bunch of fives. You just have to have that field populated there. The payer ID number, that's going to come from your integrated clearinghouse. So we have integrations set up with several different clearinghouses. There is Navicure, there's Change Healthcare, There is Ability, Availity, Office Ally. There's like a HEW. There's like a lot of different clearinghouses that we integrate with. Now, if you have any questions about if the clearinghouse you're using has an integrated capability with Iconotes, all you have to do is reach out to us and ask. And we are willing to create integrations with other clearinghouses as long as they're willing to work with us. Okay, but that payer ID number will come from the clearinghouse. Some of the payer IDs are the same across the board, no matter what clearinghouse it is, such as with Aetna. That payer ID number, no matter what clearinghouse it is, will always be 60054. However, there are some other ones that may change, such as Blue Cross Blue Shield from state to state. I do know TRICARE is consistent across the board, but you do want to check with your clearinghouse for that payer list. Okay. Now, there is an eligibility ID field as well, and I'm only focusing on these parts because they are super important. We currently only have integrated eligibility with Navicure Clearinghouse as the clearinghouse. So if you're working with Navicure, they would have sent you a list of eligibility IDs that you can type into this field. Okay, and then down below you can say how you submit these claims: electronic, paper, or other, and then that's a function I'm going to show you that you can use in the billing productivity report when we go to submit these claims. Okay, and if you were billing with the UB04 institutional, that's where you would put that option. Now, I do want to point out there are some people who have questions sometimes when you see a list of payer agency options on the right-hand side. This is specific to the insurance payer. So you may have an insurance payer that wants you to send as a group member, and they always want you to send the rendering provider a loop. Or they'll have some other kind of stipulation that is only for that payer. I have one that I feel like I have to click a checkbox on every single one of these. So if you have a payer like that, don't worry, you're not alone. There's always one in every batch. So you could just click the check boxes as they relate to that one specific payer. And then the thing that you want to make sure that you do after you make all that hard work is you click save. That's going to save it and update it to all the patients that you have this payer linked to. Okay. And I don't have anybody linked to this one, which I really didn't make that many changes, but it will tell you how many people are linked to it. So if you have 362 people linked to your Medicare and you have to change the payer ID, change it here, save it, and it'll update for all 362 of those patients. All right. So that's it for the group level settings. That's the main areas that you want in reference to electronic billing. Okay, then I'll click over to the specific to individual. Now in this section, you're going to want to make sure that you have that MPI number, tax ID, and identify it as a social or an EIN. And then down below in the lower right hand corner for government claims, do they accept assignment and their rendering status. Now, if you click sole practitioner, that means that your business name is the same as what your actual name is with your credentials. Okay, and it will not put the group MPI number on there. It will only be rendering all the way. Okay, if you put group member, it will put the practice name, and then it'll have the provider name as the rendering provider. So you'll have your group MPI and your rendering MPI both on the claim. Okay. And I've had people who have, like Blue Cross Blue Shield, wanted them to get an MPI number just for Blue Cross Blue Shield. Or if they've worked in different states, the MPI number may be the same, but the tax ID may be different. So you can set that up. There are alternative options here. And then back in the insurance area, there is a section that you can say, for this payer, I want to use this alternate tax ID or this alternate MPI. And let me just flip back over here so that you can see it. It's down here at the very bottom. And that's specific to that one payer. Again, there's usually one in every batch. So if you haven't gotten one, well, don't worry, it's coming. Hopefully not, but we should be so lucky. All right, so those are areas that you want to make sure that you have populated. I'm going to actually click over here to someone here who doesn't have any of this information and just pop in that detail there. And then if you have like a lot of tax ID numbers that are the same no matter what, you can actually just copy that click over to that other person and paste. Now I'm not going to paste here. I'm just going to put in this number. There's the EIN. There we go. Nice and clean. Okay, and if this person's being supervised by anyone, you can select this over here. This supervisory part is if someone needs to co-sign notes or review notes for people that they're supervising. This does not bill on that claim under that person's name. The section you want to go to for that is under the billing rates and pay rules. This is where you set up the different codes that you want to use. Then this is why you want to create a short list back in the group level settings, is because this will give you a nice short little list that you can pull from. If you use 10 codes, put 10 codes in your short list, then those 10 codes will show up here. You'll want to enter in that code, the modifier, and you can put in a straight billing rate, so just a flat rate that you charge for that code, because you know the insurance companies are going to pay what they want to pay. Or if you wanted to break it down by payer, you can click here and select the payer. So let's say for 90834, I have Aetna here, and Aetna pays $75.22. And then you'll want to put in the code again if you're going to do this fee schedule part here. This is for Medicaid, and they only pay $65.05. And they want you to put in a modifier for your specialty. There you go. So you can set these different areas, and just if you wanted to do it that way to make your accounts receivable report more accurate, you can definitely do that. If you have 50 payers, this is going to take a minute, but it's worth putting it in there so that your information is accurate. If you're just getting started and you want to come back and do that part later, put in a standard rate, bill those out, then you can get your remits back in with what the allowed amount is if you don't know, or if the fee schedules for that specific payer are not transparent. All right, so there you go. That's just how you set that up. Now, if you already have this feature set up, like these billing rates for another provider, already configured. So let's just say here I have my billing rates there. And then I want to copy these rates over to Miss Betty here. What I can do is I can just click copy. Okay. Click over to Miss Betty there, and I can paste. I can choose whether I want to delete the rates that are currently in there, or do I just want to add to them. And I actually want to get rid of those. And then you can just copy and paste those rates right in there. And if there's anything that you need to change, you can come in here and change. Like if she uses a different modifier, you can say, all right, for this one, I want that modifier. Okay, so those are just really cool functions you can do. The same idea with the provider pay rules. If you have these already configured on one of these other individuals' account, you can copy it and then click onto the next person and paste those same provider pay rules. And this is the section that if you want this claim to go out under someone else's name, like the bill under supervisor or incident 2, you can actually click right here and say who you want it to go out under. And if you had somebody who's credentialed with all the payers except for one, such as we'll just say Medicaid for now, you can do that there. So for Medicaid, they will go out under Ray Morris. If it's anybody else, it'll go out under Miss Betty's name. Okay. And there's other things you can do, Medicaid, if you are billing this H code and it always has to have these specific modifiers, you can populate that here. There you go. You can put in your rendering taxonomy code. That's for the provider. So this will be Miss Betty's taxonomy code. And then you have billing taxonomy code, and that's the taxonomy code for the group. Okay, so it's defining that kind of organization. I know there's a lot of codes, MPI numbers, billing taxonomy codes, Medicaid numbers, CPT codes, HIPAA codes, ICD-10 codes. I know there's a ton out there, but I promise there's a method to the madness. And we have a field for all of those here in the program. Okay. All right. Now, I'm going to skip the billing service combos. That's if you're doing, like if you want to auto-calculate the number of units based on the codes, more like if you're in community behavioral health centers or mental health centers, where they do that part. You can set up your billing service combos, and based on some of the selections, it'll auto calculate the number of units and or change the place of service. Some people use that in telehealth too. All right, that's a little more intricate, so I'm gonna bypass that part right now. But if you do have any questions or you want to go over that section, you can always schedule a consultation or reach out to our support team. Okay, so I'm going to move on to the ICD-10 codes. This, while related to billing, this is just a little shortcut I want to show you because some people may not have seen this yet. This ICD-10 codes tab is where you can create a list of like a favorites list of the diagnoses that you use. So you can actually enter in the codes here. So like if you know what the code is, you can just type it in and it'll look it up for you. Or if you don't know what the code is, there's another tab over here to the right that you can click on, and then it'll select from a drop-down list here. It's pretty massive. So it's got the full ICD-10 set from A to Z, and it'll just branch out for you. You can get more and more specific with some of the selections. There you go. So if you click back over to this other tab, that list will be there for you. All right. Fortunately, and I'm so happy about this, we also have a copy and paste button. So if you have a list here under someone else's name, copy, click OK, choose your other provider's name, and paste. Feels so good. All right. So those are some of the main areas that you want to make sure that you touch base with when you're configuring your settings for electronic billing. And now we're going to look at some demographics. Okay, just so you can see those areas and you're aware of what you need to populate in there. So here I'm going to go to Jennifer Carter. Okay, we're going to go to her demographics in the upper left-hand corner. Now, if your demographics do not look like this, just let you know that this is the new interface for the demographics. It came out, I think, the end of January. Okay, so it's only been out for a few weeks. Okay, and if you like this view, all you have to do is, if you are a security administrator, just send an email to ticket@iconos.com to get moved over to this version. All your information will pull over. It's just the layout changes. I like it. I think the color scheme's really pretty. But the other version, the previous version that most people have right now, there's like a huge box here in the center, and that's more related to inpatient or if you're doing institutional billing. Okay. What we did is we just moved that into a different tab called Episodes of Care. So it doesn't disappear. It's just moved out of the way. All right, so back to billing. There, here under the patient information tab, you'll have your fields highlighted for billing in yellow, and you're just going to want to make sure you have the name, the address, the gender. You can put in the zip code to look up the city and state, and then you need to put in a phone number. The home phone number is highlighted in yellow, but you can have a cell phone number instead. It used to be back in the day that you had to have something in that field, but because most people have cell phones now, you can leave the home field blank and then have the cell phone field. But you have to have one of those numbers filled in. Okay. And of course, you need an ID number and some of these other fields that you see that are in this orangish peach color. Those are optional, but they do relate to billing. So if you document that there on the screen, and it does tell you that down here at the bottom where an alternate show button is there for you. So those other fields are optional, but they will populate on the claim if you need them to. Okay. So again, we're just moving through the tabs. There's your episodes of care if you're doing inpatient, and it also marks your condition related to employment, which you have to have on all claims, whether they're institutional or professional. And then insurance information. Okay, here on the insurance information tab, you have coverage details right there. Okay, if you don't have any payers on here, you're going to want to click the new button. And if you recall, we created a short list, and now that drop down is available here. So you can make your selections. Okay. Putting your policy number or member ID number. Just making up a number here. You can drag and drop if you need to move it to a different area. You can also put in if there's a copay, and then the relationship to insured. If it's self, it'll populate the patient's information in this field. If it's spouse or child, it won't. You'll actually have to click copy from patient info. Okay. You can see all my details down here at the bottom. All right, so there's my information. Okay. And if this is a primary or secondary, there's a first, second, third, or fourth listed here. So there's my primary, Cigna. My Medicaid is my secondary. I can see Blue Cross Blue Shield expired at the end of 2016. You don't ever want to delete your payers out of here just in case you ever have to go back and rebuild that, or if something happens where they say, oh, yeah, it's 2 years later, I want to recoup the money for the service. And you can say, whoa, what payer are you? And it'll be listed here. The only time I'd ever delete a payer out of here is if it was entered in error. Okay. Any other time, if it expires, you just put an end date right there. And what will happen is all the claims dated from 12/31/2016 prior will show Blue Cross Blue Shield of Puerto Rico as the insurance. Anything from 1/1/2017 forward, we'll have Cigna, and now we have Medicaid as a secondary. And I can say they just got it this year. Okay. I know it's really crazy. I love how it happens like that. Okay. So down below, if this person is self-pay, there's a self-pay checkbox. If you need to mark them as self-pay or private pay, that will prevent it from getting billed to the insurance. But that's not what this session's about. So we're going to go through and do the rest of this. I do want to point out the eligibility feature, that there is an eligibility feature with Navicure. So if you're integrated with Navicure and you have that feature with them, we just need to know, and we can activate it here. So that as long as you have their insurance information in that eligibility ID, and you also have where seen selected down below, that you can click check eligibility, and it will give you that information if it's available. It will say if they're active or inactive. Now, I don't think I had the eligibility in here for this person, so I'm going to make up a number. There we go. There's a check, and normally it would have their name right here. Being this is not a real client, it's not going to have any information, but it would have their name there if it's active or inactive, and then it would populate these boxes appropriately. And if it doesn't, there is a view all benefits, and it would have a list here. And I'm sorry, this isn't a good example, but it's not a real person. So there you go. And you can scroll through there and find the data that you need. All right. So what I'm going to do is I'm just going to go ahead and click continue because I want to move into the fun part, the actual billing. Yay. All right. So I did say that there were 3 parts: the settings, the demographics, which those two, once you set them up, you don't really have to touch them except for to update them. And then the third part is the actual note. Now, some of the people on the call may not be clinicians. Some of you may be, one man or one woman band. You may be doing everything. So just so you are aware of what pulls into the billing, it's 3 things from within the actual note itself. So I'm just going to create a progress note in OnRx. I'm not going to do any clinical stuff. I just want you to see what it looks like. Okay. So the information that pulls into the claim, there's 2 parts down here at the bottom, and I do have my screen zoomed in. So let me scroll down. Down here at the bottom, your diagnosis is 1, and then the clinician down here at the bottom is the second. If you have this person assigned to billing or supervisor, it'll put the supervisor's name on the claim, but when we go to the report, you'll be able to see both. You'll be able to see Ray and whoever her supervisor is. Okay. But you got to have the diagnosis, and it needs to be ICD-10. If you're not using ICD-10 by now, then you got some problems. We want to make sure we address those. Everybody should be using ICD-10 at this point, unless you're billing for services for September 30th, 2015 and prior. That's the only time you should be using ICD-9. Okay. All right. The other part that you want to make sure you have, of course, beyond the data service here at the top, is your service code. There's an enter button there, and there's a drop-down list. And these are the service pulling from the service code short list that we created, which, by the way, if you have clinicians who You only want them to see 5 codes that you put on their list, but your short list consists of 20. There is a feature for that. All you have to do is let us know that you want that to be limited to their billing rates. We can turn that on for you. And actually, you can turn that on yourself if you're a security administrator. There's a group rule for it. All right, so on here, what you can do is you can just select whatever code it is that you're billing for. It'll pull over whatever rate, and I have some modifiers automated here to populate for me. Okay, and then you can just click done. All right, if you have more than one code line, you can put in as many codes as you want, but you got to have a code with a rate, and so we know what to charge. Okay, so those are the main areas that you have to have for that section. I'm just going to compile it because it's not a real note. I'm just making it for billing purposes. All right. So that is the last thing. That's what's actually creating the claim is the note creation. Okay. So I'm going to go back to the chart room and we're actually going to get to the fun part of submitting these claims. All right. So what you want to do is you want to come up here to this reports menu and you want to go to billing productivity report. This is about the 7th report from the top. Now that may change later as we expand some of our reporting features, but right now it's the 7th one from the top. Billing productivity. You're going to select that option. There is a default search that you can set on here. So some of the things I'm showing you as if this were your first time. You may have already some of this already pre-configured. But you can configure some of this stuff here, set it as a default search, and then it'll always come up for you. So when you are setting this up, you want to select your date range here, clear your patient filters, and clear your provider filters. Those are some areas that you want to make sure that you touch base on when you first come into this report. This is so that you can pull up all the claims within this range for all patients, all providers. Now, if you haven't set up this part, this default search yet, I would recommend that you click Note Search Options and you deselect your treatment plan so that all your treatment plans don't populate into this area. Okay, now if it's something you bill for, I mean, you can leave it on if you want. And then I have some people who don't want a note or claim to populate in here until it's finished and signed. So if it's not finished and it's not signed and you don't want it to come in your report, you need to uncheck these 2 little boxes right there. Okay. If you're fine either way, because you know your providers are going to finish their notes on time, then that's perfectly fine. You can leave that as is. The other button you want to click on is e-billing and insurance options. Okay. And you're going to want to have it set up so that it excludes your self-pay, your prepared saved to file, and your manually marked as submitted. By unchecking those boxes, it means that when you go to submit your claims to the insurance, your self-pay clients will not show in here, nor will the claims that you have already submitted show. Okay, because we don't want to accidentally resubmit those and get that duplicate claim, denial. I hate those. I mean, I know it happens, but it just feels like a waste of energy sometimes. All right, so if those boxes are unchecked, then you're good to go. You don't really have to mess with anything else. There are other filters in here. If you wanted to search by insurance payer, insurance type, or even submission method, you could say, hey, I want all the ones that go out as electronic. You can set that. But for the default, I wouldn't even mess with anything else except for possibly the submission method. Okay. And the other part that I always like to make sure to mark is exclude non-billable services. So if you have them marked as non-billable in the group level settings, or if it's been selected in the note, that will exclude it from this report. Okay, once you have your settings how you want them, you can set the default search here. It'll pop up. This is the old version of the billing productivity report. You just click save. Okay, and then that will set your default search. The only thing you may have to do is rearrange your dates because those dates don't stick. And you may have to clear patient filters and clear providers. Everything else, though, will stick. Okay, so once you set your date range, clear your patients, clear your providers, then you're going to come down here to billing report expanded. billing report expanded. Let me just fix this date back to last week. I'm a bill every day kind of person, but there's some people who like to bill every week or every couple of weeks. Now, I like to bill every day. Get those claims out. There's your billing report expanded. So this is what your billing report looks like. So what happens on here is whenever you have your billing report, it's going to show you a list of all of your encounters. Again, these are all notes that were created, and each one of these rows is a claim or encounter. Okay. And if you want to know how many you have, there's a summary box in the upper right hand corner. I have 39 encounters, 10 are ready to go, 29 are missing information. Oops. So we want this to say all of them are ready to go, or, at least 90%. So what we need to do is look and see what's going on. On this very first claim, I can see the client name, the ID number, date of birth. I can see the diagnosis, ICD-10, ICD-10, ICD-10. And then down below, I can see who the payer is, the policy number, and what that copay is for that person. Okay, everything looks good there. Here's the provider. And if this were bill under supervisor, it would have their name listed, just like the claim below that you see here. Okay, there's the location. There's the date of service. Guess what I don't see? The billing code. The billing code would be right here. If there were an authorization necessary or that had been applied to it, you would see it in this box. And once you select the code, it usually puts in the charge. So I'm just missing a few things in this section. We have our program set so that if you're missing any of those required fields, those basic required billing fields, our program will tell you not ready to submit e-bill, click to see missing information. You can click on that and it'll say, ooh, encounter information is missing. I need to go to the work areas to fix it. I'm missing my billing code, my procedure code. We have little buttons over here to the right, edit demographics and edit work areas that you can click on to fix it. Now, mind you, this is my notes, so I know I can fix it, but you can edit, I can edit the work areas here, and it will pop up and it will give me a list of details here. I can see the provider, note date, the site. If I needed to make this person bill under a supervisor, I could select from the provider list here, which I'm not going to do it because in here I'm my own boss. So there's my diagnosis codes, and then down below I can see my billing code right here. I just click that little edit pencil and just pop my code in there because I already know what it's supposed to be, and I can click done. Okay, for this one, I don't need a modifier, so I'm good. And I'm just going to click continue. Now, once I've added that code, which I can now see, and that charge, I'm just going to recheck that status, and I get the green light. Whoop, whoop. So once you get the green light, you are good to go. You have all of the basic required fields in here. Okay, so you want these to all be green. If they're green, that means they're good to go. If you need to add any additional billing information that's not part of the basic required billing fields, you can go ahead and add it at this point. We do have the chart flags that are on the chart. If you have any of those, you can see them there. Okay, you can hover over them and it'll tell you what it says, or you can click on it. This person's out of state. Make sure you choose out of state codes. This one here requires an authorization. I can click on it so I can go through and add those on there. There is a button over here to the right for managed care authorizations, and you can also look at any uploaded documents. Okay, if you scan in the copy of the insurance card and you just want to go to documents and take a look at it, you can do that from here. Okay. I don't have any for here, but you could view that document, and then when you're done, just go back to the billing report. The same thing for the authorizations. Like on the second one, I know I need an authorization. I can see the JJ authorization, and it was issued this month. So I can go back to the billing report, edit work areas for this other one, and I can select my authorization right here. I better put in my billing code too, if I want to get paid. This one was actually an hour, and I can hit done. So there's a lot of functionality right here from the report. This is so you don't have to go 20 steps back to go 2 steps forward. Okay. And by the way, if you did need to go to settings to update something in settings, there's a button there for that as well. All right. So you'd want to scroll through here and just make sure that you get most of these that are green. Now, I'm not really concerned about that right this second, but of course you want all yours to be perfect. And once you have them where you are ready to submit them, or if you don't want to submit them just yet, you want to leave them, unready, you can do that. And then you will click Prep Claims and Submit Claims here at the top. What Prep Claims and Submit Claims does is it preps everything on the page that's ready to go. If it's not ready, like the second one, that one won't get prepped because we're not going to let it be released if it's not ready, if it's going to be rejected because there's no demographics in there. I mean, that's just basic common billing stuff that you have to have. Okay. So you will prep these claims. And once you click Prep Claims, it's going to pop up a box and ask you, do you want to prep these as primary or secondary? And I'm going to say primary because I'm submitting these for the first time. Okay. It'll pop up a claim options box for you just to confirm that. And you're going to click continue. Okay. It may take just a moment to prep those. All right. And then as soon as it is done, it's going to pop up here for us. And then I'll tell you about the selected claims. Excuse me. Okay. So once these are prepped, they're actually going to turn from green to blue. Okay. And it'll have the date and that it was prepped. It's pending right now. Primary with secondary. All right. Now, if you hadn't have wanted to prep all of these claims, let's just say you wanted to prep one, there are select buttons next to them. And then that's where you come into the prep selected and submit selected option over here. Okay. Sometimes it may be green, but you want to check to make sure that no modifier is necessary or you want to wait on sending it for whatever reason. You can select all except for that one. So there's a lot of really cool functions that you can do with that too. Now, once these are prepped, all you have to do is click submit, or if you're using the select button, you can submit as selected, submit selected claims. So whichever one you're using. I do want to tell you that I've had, sometimes where you had to make a change for one specific claim and you want to make sure everything looks good on it. You can actually click right there on the blue where it says click to view. And it will give you a preview of the paper claim. Okay, because sometimes people are more familiar with, hey, this is box 24J, but really it's, loop such and such, segment such and such. Okay, so that's just if you want to look at that paper version. What's really going to the payers is this ANSI 837. Okay, this is called an ANSI 837 P for professional. Okay. And you can click on that and it'll show you the actual electronic claim that's going to the payer. So I can see my site. I can see who the clearinghouse is. There's my billing site. There's my tax ID. There's the patient information. I can see Blue Cross Blue Shield is labeled as Blue Cross Blue Shield. And I can see down here is my diagnosis. And I know this is really exciting. It's exciting for me. Again, I'm a different breed. So there's our code, 90834, $150, 1 unit, and then so on and so forth. Okay. You can just click continue if you already know what you're looking for. Most people like the pay-per-view. I mean, I kind of like it too. But once you're done looking at that, just if you need to check it for whatever reason, then you can go ahead and click submit claims. Okay. Now, when you submit the claims, these turn purple. And you get a pop-up just letting you know the claim has been saved to the document site. It's now being uploaded to your clearinghouse. That's if you're working with an integrated clearinghouse. We recommend confirming the receipt of this batch by the clearinghouse. So you need to make sure that you have a training with your clearinghouse so that you know how to do this part. Make sure that those claims are received. It takes about 60 seconds to get over there at the most. Usually it doesn't take quite that long. Okay, when you click OK, these turn purple or a nice pretty lavender color, if you will. And then if you slide over to the right, you can see the claim history. Okay, this feature just became available April 6, 2013. Okay, so about 5 years ago. Okay, so anything that actions that were, if you were a customer before then and you've been doing this and you're like, where's my stuff from 2012, it's not going to be on here. but it will show the date and the time, who prepped and submitted this claim. Was it primary with secondary, secondary with primary, or primary only, or secondary only? And then it'll have sending. Now, once this is sent, it'll turn either green delivered or red delivery failure. You get a pop-up message to contact our support team. But mine have been delivered, and delivers for the whole batch. Okay. And then there's one of the ID numbers, and then you can see what payer it went to in the payer ID. I've had some people where they've sent it over and the payer ID was wrong, or if you're one of those people who service TRICARE. Clients, TRICARE North and South have merged to TRICARE East, and they now have a new payer ID and a new person managing it. Okay, so those are some things that you want to make sure, hey, for all services before January 1st, 2018, those go to the appropriate TRICARE North or TRICARE South. Anything from January 1st, 2018 forward now go to TRICARE East, and they get delivered to Wisconsin. Whew, all right. Like I said, I get excited. All right. So I'm just going to scroll back over. And at this point, I mean, that's all you got to do to submit your claims. If I were to click the back button to go back and then click billing report again, okay, all the claims that I submitted already are filtered out. These are all the ones I have left, which are 28 of them. So I'm going to get on those. I'm just going to go ahead and get those ones I can get out, come back, and then I can work on these. All right. So that is how you submit claims. I want to go ahead and take you to the patient account part. This is the area when you are submitting, after you submitted your claims, you want to, if you're working with an integrated clearinghouse, and I just have to keep saying that because if your clearinghouse is not integrated with us, then you are going to have to post all of those payments back into the system manually. If your clearinghouse is integrated with us and you have the electronic claims and you get the electronic remittances or the electronic EOBs, also called ERAs. I know it's a lot of acronyms there for you, but that is what we are working with. Let me see. All right. If you get those electronic, then what happens is they get pulled into auto post payments. It's a tab right there called auto post payments. Okay, and this is in the patient account part. So either you come to patient account and click auto post payments, or you can be on an individual's account, or you can be in the billing productivity report. There's a lot of access points to get to this section. But this tab, auto post payments, is where those electronic remittances come from your clearinghouse into Iconos if it's integrated. Okay. Now these pull in every night. So if you have like $5,000 worth of remits sitting in your clearinghouse today, they just came in today. Tonight after midnight, we'll pull them into Iconos, so they'll be there for you when you come in the next morning. Okay. And the way that it looks is just like this, okay? Your screen is cut in half, and I'm sorry my little drawing there is crooked. You'll have all your imported remittances on the left. That's what we're pulling in from the clearinghouse. On the right-hand side are Iconos service charges that match the remittances. So if you bill out of our program, it's going to create a charge in the patient accounts. So when those remits come back in, when they circle back around, they'll match up to what's coming in. So that's good. So when you come in here, you'll have the ones that are matched and ones that may need to be reviewed. They'll be orange and yellow. Orange and yellow is good. Good. That means that information's coming in, it's linking up, and some of these you may just need to review. I always recommend that you click Show Payers so that you know who the payer is that you're getting paid for. And if you're working this pretty regular, you probably already know, but here it's a check from United Healthcare. I can see the check date, which was February 2nd last year. There's the check number and the total paid amount. And there I can see that's the total paid amount. Okay. If you want to see some of the additional details that come in with the remits, like, oh, do they have a co-insurance? Is there a co-pay? Is it owed to the deductible? Sometimes you may see where the paid says 0. Now this is all on the remit on the left-hand side. Paid 0 is going to be on the right because, well, we haven't posted anything to the service. If you do see a paid amount there, it may be a patient payment, or you may have already posted it, or this may be a secondary. But if this paid amount said 0, you can show details, and it'll tell you like what those little COB adjustment codes say. Like CO45 means it's beyond the allowed amount. So it's the difference between these two, your billed amount and allowed amount. Okay. So it's going to adjust off $59.75. All right. I always recommend looking through these. These do not post to the account automatically until you click your post button. All right. So this just gives you a chance to review these. Everything looks great. If you're ready to post it, you're going to click post match payments here at the top. Okay. If you don't want to post one of these, let's just say one of them looked weird, there is a little gray X to the far left that you can click to hide it. Now, if you were to click that post payment button, it would only post what's visible here on the screen. Okay, so this one charge would go on there and the other charge wouldn't. Now, in this case, these are both perfect, so we would post them. All right. And if you want to bring that back up, that one that you hid, you just click the little search button here. I call that the baby search button in the upper left-hand corner. All right, I'll bring it back up. So that's all you have to do is just go through, review it, make sure everything's kosher, and then you'll post match payments and you'll get a pop-up that says, hey, can I post this? Please verify that you want to do that. All right. And then you can click post. All right. There is another really cool feature. And again, you have to ask for this because we have to train you to make sure that you know how to use it. If these do not forward to the secondary, then there is a post prep option that you're posting that primary payment. And then when you prep it, it'll prep it to go to the secondary insurance too. You can always tell if it gets forwarded to the secondary automatically, because here it would say processes primary forwarded to secondary. There would be like an option for that. Forwarded to additional payer. Sorry, not secondary, but forward to additional payer. Medicare, Medicaid are amazing about that. They'll communicate with each other. You never have, there's what they call a crossover claim. So you'll never have to worry about those two. But sometimes you may have a different primary, like sometimes Blue Cross Blue Shield doesn't want to forward to Medicaid. Sometimes they do. It just depends. All right. So that's a really cool feature. Just post match payments. Click post. If you just want to post it, post prep if you want to prep them all if they have secondaries. Okay. So I'm going to post those. It's going to give me a confirmation that these have been posted. I'll click OK and they turn green. That means they're posted to the accounts. And then you can also see now the paid here says $70.25 and it matches what was here. You can also see the adjusted posted over. So it pushes everything into the patient accounts. The data service, the actual code, what was billed, the patient responsibility, what was adjusted, what was paid, puts the check number in there, who the payer is, and what the date of it was. Okay. Now there's a little eyeball. There's two eyeballs actually. Well, three on this screen, but the first one next to the patient name, you can click the little eyeball and it'll take you to their account. Okay. But over here on the right-hand side, these little eyeballs, if you click on it, it'll open it up that service charge so you can look at that. Just if you needed to do anything on here, if you wanted to look at the insurance claim details, hey, this is the claim number, filed amount, when it was paid. You can see those adjustment reason codes and what those mean. You can even open up this payment. Click the little edit pencil, and then you have all your details right there. I know this says Blue Cross Blue Shield, but we're just going to pretend it's Aetna. And then there's all your information and your adjustment code down here at the bottom. We thought they had a copay, but obviously they didn't. Okay. And then you can just click done if you're done. There you go. And then that's it. I mean, that's all there really is to the posting of the match payments. Now, there may be a situation where the remit came in electronically, but it didn't link up. Yeah. So here, let me put Jen. All right, Carter. Let me get my little person here. There she is. All right. So I have some remits that came in that don't match up. In that case, you can look at it. I can look at it right here and just tell her name's Jennifer. It's not Jen, but for some reason it came over from the payer to the clearinghouse to Iconotes as Jen. So you can actually correct that. There is a tools button right here that you can click on, and you can say patient name mismatch. And is that her correct name? No, it is not. Her name is Jennifer. Okay, sometimes that happens. 90% of the reason these are mismatched or unmatched in Iconotes is because the name doesn't match up. It's hyphenated, or they added an S to it, or part of the name cut off. I see that sometimes with Christopher. Sometimes it'll cut off it and just say Chris if the last name's too long. Yes, I want to update for all of these. And here I can see that now it matches up with the service that's in Iconotes. And you can actually verify the match. If you have like 20 of these, you can just uncheck the show details and you'll get a button that says verify all matched. Once these are matched up, you can go ahead and post them, and then that will be that. All right. So that is the auto post. Okay, now there's more features in here that you can utilize, of course. There's claim status codes. If you're trying to look for one remittance to see if it's even in here electronically, you can type that into the payment identifier field and then click search, and it'll pull up all those that match up. I say click all these check boxes and put that in. There's a lot of other little things that you can do for the auto post.